endometriosis is, but do you know about her ugly sister, adenomyosis? Both endometriosis and adenomyosis are painful progressive disorders of the endometrial tissue. Fortunately, these diseases are treatable and are not life-threatening. Unfortunately, there are women who suffer from both, and it could have an effect on your fertility. On this short documentary, I am going to give you more insights on what endometriosis and adenomyosis are, as well as give you the differences and maybe give you a few solutions you could incorporate if at all you are suffering from the two. Different life stages are associated with specific women's sexual and reproductive health issues, including menstruation, fertility, cervical screening, contraception, pregnancy, sexually transmittable infections, chronic health problems such as endometriosis and polycystic ovary syndrome, and even menopause. Endometriosis and adenomyosis have similarities, but the difference comes in where the endometrial cells grow. With endometriosis, the cells grow outside the uterus and usually in the ovaries, the cavities of the pelvis, and the supporting ligaments of the uterus.
My name is Taylor Caroline. I am a student, a 23-year-old, and I'm also a mom, to a beautiful baby boy. I was diagnosed with endometriosis at 15 years old. I was in high school, Form 2. When I started my menses in Form 1, but with time, it started becoming like more intense and more painful, to an extent that sometimes I would even faint. And that's when, the minute I was rushed to hospital and the tests were run, that's when I was diagnosed with endometriosis.
So what are the symptoms like? How do you feel when you're going through your menses?
Okay, for us, we can say, for someone who goes through, there is normal cramping and now there is endometriosis, and some people actually confuse the two. There's just the cramping, which is normal. I can say when I started my menses, actually my cramping was just normal and bearable, but later it now it became worse and worse as I was going on through the months. I have regular flow, so every month you go through the same amount of pain. For someone who's had maybe a woman talk about maybe labor, I've gone through labor, so I can tell you the only pain I can compare that is close to endometriosis is labor pains. And of course, if you've had people talk about labor pains, they'll scare you off because they are really intense. So the symptoms for me come as every time, every month I used to have my menses. On the first day, I would start now feeling the abdominal pains and now the pain would go to the lower back of my back. So the pain is the same as contractions. It's just not like the normal cramping. You feel so much pain on your lower back, on your abdomen, which transmits also even to the stomach. You feel like the whole part is just a lot of pain, excruciating pain, even to the back. Then sometimes it also goes to the legs and you feel numb from this part downwards. That's what used to happen. Then, when I feel that much pain, it would go to even to the head. I would feel a headache, this type of headache that it's like
a migraine.
It's like a migraine actually. Then later I would, there's a time when the body feels so much pain that it can't handle. Some people react through losing consciousness, and that's what used to happen to me. The pain would be so much when it gets to the head and I get that bad migraine, it would transmit to me just losing consciousness.
Following these intense symptoms, are you under any sort of treatment?
Okay. When I was diagnosed in Form 2, I underwent treatment. I used to go even for clinics and checkups every now and then. But when I finished my Form 4, I actually underwent the treatment for 2 years, then stopped because it was getting better. But later it came back and I went back. But immediately after I became pregnant, when you become pregnant, you don't get your menses as normal. But before then, as I was going to see my doctor, he used to actually tell me that it would get better, might or might not.
With adenomyosis, the cells grow within the walls of the uterus. As the wall grows thicker, it can cause pain and heavy bleeding. Age is also a differential factor, as most women who suffer with endometriosis are younger adolescents and those of reproductive ages, whereas adenomyosis usually affects older women.
My name is Tracy Gathoni. I am a procurement and logistics manager by profession.
When were you diagnosed with adenomyosis?
April 2020, early April 2020, yes.
What symptoms do you experience?
Personally, I have a couple of symptoms. However, mine vary, or actually adenomyosis symptoms vary from case to case depending on the patient. So mine usually include heavy periods, cramps, but my cramps do not, they're not limited to only when my cycle is on. So this can be 20 to 30 days of the month. I experience lower and upper back pain. I have pain radiating from my pelvic bone or area to my thighs and sometimes my legs. I also experience nausea, headaches. The most interesting one is ass pain, and a common one actually for most ladies who actually start to look for medical assistance is pain during or after intercourse.
How has it been like living with adenomyosis? Like, how is your day-to-day life like?
First, let me give a background of how long I've actually been dealing with adenomyosis. I started seeing gynaes at a really young age when I was 16, 15, 16, because that's when I started to realize that it wasn't normal, because my cramps would not only happen during my period cycle. So I would experience, back then I would experience pain normally before my period, 2 or 3 days, and then during. But then what was interesting is that almost a week later, I would still be cramping. And then my periods are not for long because they actually don't go more than 3 days. But I would go through 2 or almost 3 packs during this period. We're talking about 16 to almost 24 packs. So the pain was actually the reason that got me to start seeing a gyna, or gynas for that matter, because I saw a couple. I did quite some rounds in Nairobi, and it was only last year that we got a confirmation on the diagnosis, because for a very long time I actually thought I had endometriosis. So, which is very common because most women actually take almost between 6 to 14 years to actually get a confirmation of diagnosis on adenomyosis because of the wide range of symptoms. 1, 2, not very many people show the same signs always. So it's not really been easy, but I think I got to a point because that period when I was 15 and 16, I'd seen so many doctors and nobody could actually give me a specific reason as to why I was experiencing this. So I saw a neurologist, I saw this a nervous system doctor, but no one could actually say for sure what the problem was. So it got to a point where I was okay with the pain. I was dealing with the pain in a different way because painkillers were not even working. Like last year, for me to actually push for an MRI, because that is how I got the confirmation of diagnosis that it was actually adenomyosis and not endometriosis. I was living on almost 8 to 10 painkillers a day. However, most people will tell you a lot of options, but very many people deal with them differently. So it has been suggested diet could help with elevating or relieving the pain. So people will tend to avoid dairy, will tend to avoid coffee, will tend to avoid wheat and wheat related foods. But for me, I didn't find diet really elevating any of these things. However, I am not currently, actually for almost 2 years now, not consuming milk because I found it really made the nausea really bad. So I stay away from wheat. I also try to stay away from fatty foods unless I don't, or I really want to indulge. Yeah. But for me, the other thing that has worked is exercising, because yoga really helps with the back and the leg pains, and also just for the mental peace. Swimming also helps. It helps keep the weight in check, because one of the other challenges of dealing with adenomyosis, apart from pain and just the crazy periods, is weight gain. So your body tends to retain more weight than you like, and having given birth, that also doesn't help. So I try to exercise, gym or swim, depending on what is there. Or how I'm feeling. I have tried some herbal remedies, like Harriet Botanicals. Very good. I have a colleague who is using it for fibroids, a friend. But for me, it really made the nausea bad. So after the first bottle, I didn't continue with it because of the nausea. But apart from nausea, you also can't use it with a contraceptive because it's a type of a fertility drug. Yes. So if you're going to be on it, then you would need to strictly be on condoms with your partner. I'm in a couple of support groups on Facebook and Instagram, and you'll find that some people are actually stuck in bed 5 out of 10 days in a month because of this. Luckily, I'm not had to be stuck in bed for more than 2 to 3 days in a month, which has been really good for me. But I have also been more on painkillers than I would like. So yeah, other people resort to cannabis or weed or marijuana, and I know that people know just the way it alleviates the pain for cancer patients. I can tell you for sure it also does the same thing for the ladies who are dealing with endometriosis and adenomyosis. However, I find that the way it works best for these two symptoms, unlike cancer where people smoke it, is that people have extracted these two oils or massage what are they called? Massage lubricants. So instead of actually smoking it, people will rub it on their backs or their thighs or their abdomen, so depending on that. Yes. So those are some of the ways I have found myself dealing with or elevating the pain. Apart from that, then the mental strength and the mental power that you need to just deal with it is not something that should be taken lightly or ignored or underrated, because it takes a lot to deal with something as simple as that. Yeah. If you're not bleeding, you're spotting. If you're not spotting, you're experiencing all the other symptoms, and it's not easy to handle. So the emotional, mental, and physical strength it takes is a lot. If you're bleeding 20 days in a month, then you're also at the risk of getting anemia. And anemia could lead to anything else. So it's something that people really need to be kind about, because it's not just pain that this person could be experiencing in this situation. Yeah.
Women, our sexual and reproductive health is important for our general health and well-being. It even helps us make important life decisions like when or whether to have children. Sexual and reproductive health is not only about your physical well-being, as it will also involve your right to healthy and respectful relationships, access to inclusive healthcare and services, access to also correct information and effective information about your health. Sexual and reproductive health is also inclusive of affordable contraceptives and timely care and support when it comes to unplanned pregnancies. I hope there's someone out there who relates to Tracy's and Caroline's story, and I hope that in future, as women, we will stand together and step by step be able to overcome challenges on our reproductive health and also help our sisters who are suffering from one or two diseases concerning reproductive health.